Hello everyone. Myself, Dr. Shyam Verma. I am a consultant laparoscopic urologist and renal transplant surgeon at Continental Hospitals. Today, I am going to talk about stricture urethra. Stricture urethra is a disease known to mankind since time immemorial. I'll tell you in brief about a stricture urethra, what is stricture urethra, what are the causes of stricture urethra, how do we evaluate the stricture urethra, and how do we treat it. So stricture urethra, as the name suggests, it's a narrowing of the urethra. Urethra is nothing but a tube which carries the urine from the bladder to the external urethral meatus. Stricture, when it happens, it narrows the urinary passage and patient presents with difficulty in urination. It can occur both in males and females, but males are more commonly affected than the females. The common two causes for stricture urethra being the inflammatory conditions and the trauma. It's also caused because of various infections and mainly sexually transmitted infections. Trauma to the urethra by road traffic accident or during surgical intervention or during catheterization of the bladder. These are the common causes for stricture urethra. Now, once a patient gets stricture urethra, patient will present with various symptoms. The common one being thin stream, straining for urination, history of recurrent urinary tract infection, intermittent stream. Patient may also complain of difficulty in passing urine, which may land up with acute urinary retention. This can be an emergency where the patient lands up in ER and we have to do an emergency catheterization for this condition. Now, knowing the causes, we'll discuss in brief about the evaluation. Besides doing routine urine test and blood test, there are certain non-invasive OPD tests like uroflowmetry and an ultrasound KUV with post-void residue, which will let us know how narrow or how poor the stream is. But it won't tell us whether it's an obstruction or is because of the weakness of the bladder. So to know further details about the stricture, we'll have to do an invasive test known as retrograde urethogram. It's again an OPD-based procedure wherein we inject the contrast through the penis and we take an X-ray. Through this, we'll come to know the length of the stricture, the tightness of the stricture, and the severity of the stricture. Having known this, then we'll discuss with the patient about the further treatment plan. Broadly, we have two ways of treating stricture urethra. One, the endoscopic one, and the other being the open one. The endoscopic one is known as optical urethratomy or VIU, wherein we put a scope and cut open the stricture or narrow part of the urethra. This is a temporary procedure and it doesn't have a great success. This is done normally for a short annular strictures. But if patient presents with a long, tight stricture, then we'll have to opt for an open surgery, which can be a buccal mucosa urethroplasty, wherein we can augment the original urethra or we can resect the damaged or stricturous part and put a graft in a staged fashion. Later on, the second stage, we'll tubularize the same urethra, and later on, after 2.5 to 3 months, we'll tubularize the second laid graft in the second stage. Having done so, patient will have a new urethra and patient should be able to pass urine comfortably. If you have any of the symptoms, kindly consult urologist. If you have any symptoms, kindly consult urologist near you. Thank you.